Joint United Nations Programme on HIV/AIDS, UNAIDS, notes that in 2020 there were over 37 million people living with HIV globally. About 8 million of these are in South Africa. Since the start of the pandemic, more than 36 million people have died from the disease. Experts say the coronavirus pandemic can help shape the world's response to other pandemics.
What are the successes we must celebrate, but what are the challenges that we need to shift our gaze on, and that battle is not over. COVID has come in and taught us some important lessons, and how do we draw on those lessons between HIV, TB, between SARS-CoV-2, and improve our responses to those three pandemics, but also how do we get better prepared and we're not on the back foot when the next viral threat or other threat emerges.
Professor Abdul Karim's work on HIV has focused on prevention interventions for young women and girls and to empower them to protect themselves. Young women in sub-Saharan Africa continue to bear the brunt of the disease.
In Eastern and Southern Africa, we still continue to see about 60% of all infections taking place globally. And a key driver of this infection is the fact that women under 25 have high rates of new infections. So around age 15, 16, we start to see young women acquiring HIV sexually. And that sets them on a very different trajectory.
Social constructs and stigma mean that fewer men are testing and accessing treatment.
We have 8 times more women on ARV treatment than men. And we know that more men and women are infected with HIV. And so that is because our clinic and facility hours are more conducive for women to utilize the services. And if men are working or whatever it is that they're doing, it's not always that. Or it could be men think about clinics as places women go to because of antenatal services, in terms of, baby services, and they don't see them. They feel a little bit alienated. I'm not going to go there. It's all the women there. Or it could be, it's in my community. I don't want to be seen going there.
South Africa has made huge strides in fighting HIV. Mother-to-child transmission is at less than 2% from around 30% in 2004. The country has the world's largest ARV treatment program. 75% of South Africans living with HIV are on treatment. Factors that Abdul Karim says have turned HIV from a death sentence into a manageable chronic condition. Minoshne Pillay, SABC News, Durban.